Hello, everyone, and welcome to the PCOS newsletter and podcast. Today with me, I have Tara. Hi, Tara. How are you?
Hi. Hi, everyone. I'm great. Thanks for having me.
For anyone that obviously has been on the newsletter for a long time, Tara has already done a guest post on the mindset shifts that you need for PCOS, and it's actually been quite a hit. I think people absolutely loved it. But do you mind just
Thank
introducing
you.
yourself quickly for the audience that's
Yeah,
listening today?
absolutely. I am based in Las Vegas, Nevada. I am a registered dietitian here, and I have a general practice, but I have a big focus on PCOS. It is a lot of my patient population just organically happened that way, and so I'm focusing my research and focusing on learning about the interventions just because I see, obviously, you know this very well, this population is very underserved and there's a huge need for better education, number one, better treatment, better options, better solutions. So it's just something that has sparked an interest in me and I've just kind of went with it there. So I've been working in this space for maybe about 3-4 years now.
So let's get started with myth number one. And does the pill cure PCOS? Do
Yeah.
you get people that think it does?
I think I don't know that people think it does. I just think that that's the treatment they get from their doctor with no other interventions. It's just like here's this thing to fix what you're experiencing, right? Because it's gonna bring down your androgens, it's gonna increase sex hormone binding globulins. You're gonna have less of those hormones floating around. And essentially what birth control does is it just you have this communication all through the month going back and forth between your brain and your ovaries. And when you're taking these synthetic hormones, it just kind of shuts down that communication between the brain and the ovaries. So it's not fixing anything. I think it's a symptom management tool. And in some cases, that's what you and your doctor decide is appropriate and kind of what you need right now. That's fine. That's what you're doing. It's not fixing PCOS. It's not curing PCOS. It is not a long-term strategy. And a big part of that is because we want to be cycling. Like so many women want to get pregnant. And so it's weird when I've had clients that have gone to the doctor and they want to get pregnant and the doctor puts them on birth control. I'm like, okay. I mean, I know sometimes when there's excessive bleeding, more in the endometriosis kind of space, like that may be warranted, right? Just because of the blood loss that's happening. But in PCOS, like we want to be able to monitor the cycles so we can see how we're doing. Like, are you ovulating? Is because that's the only way you're going to get pregnant is if you're ovulating regularly. You know this. So I think that's really a myth. I feel it's very perpetuated by the medical system. Not everyone, of course, but largely perpetuated by the medical system because there's no education or explanation on, hey, this is what this medication is going to do. This is what it doesn't do. This is what's going to happen when you come off of it, or potentially what can happen when you come off the medication. But it is not a cure. It is not a fix. I mean, I hate to call it a band-aid, although that's kind of how it gets used, because I do think there's appropriate applications for any medication, right? But I think it's just this blanket because that's what doctors are told as like a first line is the birth control and the metformin. That's how they're trained, which is totally understandable. That's the training they received, but it's missing a lot because they're not like, hey, yes, I'm going to put you on this medication if you want to be on it. Also telling you, hey, here's the potential side effects. That's something that doesn't get discussed. It's a different topic. But also, hey, let's get you working with a dietitian. I'm going to send you a referral so you can start maybe looking at some of the dietary strategies that might be right for you to kind of help support this. Maybe look into working with an exercise physiologist or something to kind of explore the physical side of things. Let's look at your labs and let's see what we can optimize. And that's just not the case for most of the people I work with, at least my patient population. I can't speak for every person with the condition, but it's usually just, here you go. And that famous thing, it really gets said to women. I've had people tell me this is like, come back when you want to get pregnant. You're like, but no, I want to get pregnant. So why am I taking birth control? It makes no sense. So
Yeah.
yeah.
Yeah. I mean, that was when I was 18, I got put on the pill because I think I was 19 because till 18, they wouldn't look at me because, like they say, puberty, you can have irregular cycles throughout puberty. I used to have 2 cycles a year. That was pretty much my whole, like, I think I got my period around 12 or 13 and then all the way to 18. Everyone was like, it's fine, your cycle is just which is obviously, it's also true, right? Like it can go for certain disturbances, but there's a point at which you have to intervene much earlier, which is another topic. And the doctor put me on the pill, and this was Romania quite a long time ago, right? So like, I think things have evolved as well. But
Mhm.
from what I see online and from the people I speak to with PCOS, and as you said, you as well, like it has not gone that far that actually women are being explained what the pill does specifically for PCOS and how it works, and then what is the implication of taking it, which I
Mhm.
think this is where the system is failing a bit. And I don't think it's failing because doctors don't want to. I think it's failing because doctors just don't have the time. Because even
Mhm.
now, okay, now it's been half an hour and we haven't even like touched the tip of so many of these topics, right? Like that we could
Mhm.
go on forever. And I think the system is just so flawed in the way that they treat chronic conditions that require so much more explanation and requires a multidisciplinary team, as you mentioned. Like he's a
Mhm.
referral to a dietitian.
Yeah.
The pill does not cure PCOS because PCOS unfortunately has no cure. And I think this is a message that I want to send loud and clear yet, right? So, like IBS is also irritable bowel syndrome. PCOS is polycystic ovarian syndrome. A
Mhm.
syndrome is not a disease because it doesn't have a clear mechanism and no one has figured out what causes it. So it's just a cluster of symptoms that act together
Yep.
without a very clear cause. And when there's not a clear cause, it's very hard to find a direct treatment. Like
Mhm.
diabetes, you give people metformin, you give people insulin, and it works because the mechanism is pretty clear of how that disease is manifesting itself in a way. It's not clear of how it gets caused, but it's clear of how it's manifesting. Whereas in PCOS, that's not very clear. So by default, there's no cure, there's no kind of medication that can basically stop it and like fix it. And to be honest, now that I think about it, even diabetes, like insulin does not cure it. It basically just maintains it and makes sure that your body functions. It's not like you get insulin,
Mhm.
you can reverse diabetes. I think there's very few diseases that truly get solved through medication. If I think about it, probably viral infections, bacterial infections, because infections don't either, right? This is probably the one that like really kills the bacteria and then you're done, and obviously you have
Mhm.
others that I might not think about it. But it's so important for people to know you're taking it, but you're going to manage your symptoms. And as soon as you come off it, things might
Mhm.
look very different for you because I didn't know that. So I took it and I was like, I took it for a year and a half and I was like, oh, let me just come off it because I'm sure I'm all sorted. Like everything is fine. Of course, I was not all sorted. Like my PCOS came like with a vengeance. Like I had
Oh,
acne. I never
yeah.
had acne before, so it was never like still to this point, I'm not. I've done a lot of work, but even when I was a teenager, I was on an acne prone PCOS, so not necessarily on the androgenic kind of path of PCOS, but it came back with acne, weight gain, like it
Yeah.
was it was not nice. And I was so disappointed because I was like, I
Yeah.
thought this was pure. So I think this is where it's important to
That's a
know that,
personal experience for you.
yeah, exactly. And when I see this myth, I always get triggered because I know I've lived it. And there is evidence to show that the contraceptive pill, on top of the kind of hormonal deja vu that gives you, like the same kind of dosage, it can also increase sex hormone binding globulin, which means
Mhm.
that it kind of like your testosterone also goes down in the process. And also it reduces the 5 alpha reductase, which is the enzyme that converts testosterone
Yep.
in a more powerful one.
For the
So
DHT.
essentially, exactly that. So it does do something for the condition itself on top of just giving you this kind of more synthetic hormone, but it would not fix at the point of the problem because we actually don't fully know why, right? Could be also genetic that you're having this condition, right? And I always say to people, take it. If you're at the wit's end and you just need a break,
You need something,
you need it's like the food noise and the GLP-1s, right? Like if you need the noise away so you can focus on things, take it.
but don't
Because
let it be the only thing that you do.
exactly. Because sometimes and you might not be in a position where you can,
Yeah.
tackle PCOS in the best way possible because you might be going through something traumatic or God knows what, like there's so
Yeah.
many circumstances.
Absolutely.
And if you need a break, take it, but know for how long and know why, and when you want to come back and what you want to do about it, and exactly
Yeah.
also look at the root causes.
Yeah, and I think just as just as we've seen on the internet too, of just or in medical practice of you should take this pill, we've also seen the swing back of that because we are trying to educate people on what it does and doesn't do. There's also been a swing back of the pill is the worst thing you could ever do. No one should ever take it. And that's another thing. It's like, again, there's nuance here. I would never tell anyone not to take a medication. What I would do is I would take the time to educate them on what's happening, what it is doing, what it's not doing, the risk factors associated with it, family history of blood clots, you don't want to take birth control, what could potentially happen after. And if you decide that that's the right thing for you, there is absolutely no shame in taking a medication. And I think that's, again, just that it just depends. It just depends. I think the frustration I feel is seeing women get put on that without any of that informed consent education about what potential risks are. When they have side effects, they get dismissed. When they gain weight out of nowhere after taking it, they get dismissed. If their acne gets worse, they get dismissed. If their sex drive goes in the toilet, they get dismissed. That's the part that makes me a little bit angry. It's just the dismissal of the woman's experience on the medication. And you have to decide what's right for you. But remembering too, we do want to have a regular cycle at some point. God, especially if you want to get pregnant. But we have hormones, the progesterone and the estrogen that we make throughout the cycle have other effects in the body outside of reproduction. And I think that's something that never gets discussed is, these are synthetic progesterone. They are not identically biologically or molecularly identical to our own hormones. And so things like progesterone help support our mood. It's neuroprotective, helps with sleep, bone health with our sex hormones is a huge thing. And we need to have those on board. I mean, if we want to optimize other parts of our health too. So there's so many things to consider.
And actually, that brings us to our last myth, where where we always kind of feel like the cycle only matters if you think you want to get
Hmm.
pregnant, which is obviously, as you were saying, so untrue and false because our body, I mean, every time I deep dive into this, and I've been doing it for 3 years now, well, 5 actually, it just fascinates me of how many things are interlinked and how much one hormone does a million things that you'll never
Hmm.
think about. Or estrogen and our cholesterol, right? Estrogen and bones. Um, the gut, the vagus nerve, the gut mind
Hmm.
connection, how it works,
Hmm.
and microbiome and the hormones, and how estrogen gets excreted and how it can be
Yep. Recycle.
it's just incredible how it works. And when we just put it down to pregnancy, I think it creates this false belief in women that the period is just there for babies.
Hmm. Yeah. Yeah, I think it just really ties into what we touched on in the last myth of just your sex hormones are there for a reason. They do different things in the body. If you're in a place where you do need to suppress those for whatever reason and suppress androgens, and that's the right choice for you in the moment, then that's the right choice for you. But we do have the sex hormones influence. Estrogen influences cardiovascular health, muscle, bone density. And so we have to consider those and the equation. And, I know that in some cases, like, there's concern about shedding of that endometrial layer. And that's because there's a higher risk of endometrial cancer with not ovulating, not shedding that layer, not having a period. So that's a very like separate topic, but just for the sake of cycling and making your own hormones, those have other effects in the body that we want. They're there for a reason. And, certainly that, again, comes down to an individual decision. But also, to me, the cycle is a barometer for how successfully the PCOS is being managed. Because if I have someone who has cycles every 6 months and then over a year we get them 40 to 35, to 30, and then they're in the range of 30 to 35. Maybe they have an anomaly of 40 that comes in because something, was off. It is a barometer of how things are going, and it is really direct feedback from your body. When you start working on insulin resistance, you start restoring that cycle regularity. It is the most clear evidence that what you're doing is helping. So that's something to consider too.
100%. It's like a measurement of how well you're managing it. Even for women without PCOS, right? I think it's also
Oh,
a
100%
great
for anyone.
way of knowing, like, one, am I healthy? But also like the psychological impact of these. Like, have
Yeah.
you seen that people would choose different partners based on whether they're on the
Yeah,
I think that's crazy. Like, I can only imagine even my work, right, and my career, like my motivation. And of course, cycles can come with dips, but also like that estrogen surge that you get in your follicular phase. Like, I've,
Oh,
I promise I probably got promoted because of it multiple times. So it's just all of these things that would be less studied and less looked at. But these hormones are there to protect us and to push us in different
mhm.
ways. When you don't have that, do you really know yourself? And I don't know if I'm being dramatic, but who are you? And some people get put on the pill at 13, right? Regardless of
Yep,
PCOS or not, and
yep.
then they're on the pill from 13 all the way to 25 or 26 when they considering kind of, having a baby, or they want to see how they're doing without.
That was
And
me. I was
really,
on it at 16, and I don't have PCOS, I should say that to clarify, but yeah, 16, and I stopped taking it around 32 because I had in my mind, and I was not educated on any of this at the time. So, but I had in my mind, I'm like, I gotta get off of this for a while. I've gotta, like, my intuition was like, I've got to let my body just kind of like recalibrate, for lack of a better term. And because I never had any issues with that. So I was very lucky that my cycle returned pretty quickly. But so I was either pregnant or breastfeeding or in that recalibration phase from age 33, like age 38. And so really, I'm 45, almost 45 now. So really just the last 4 or 5 years have been the first time in my whole life that I have lived with a cycle, like a regular cycle. And to see the regularities in me, to see when my libido is through the roof. I mean, like, I know I'm about to ovulate. Like, I just know, like, it's happening. I see the cervical mucus change. And there's just something so cool about that, to learn yourself. And I say that with full acknowledgement that I don't have that irregularity that comes alongside of it, but we're just speaking to the knowing yourself and to knowing, oh my gosh, like yesterday, I felt horrible yesterday. Like emotionally, I was like just like sensitive and like weepy. And like last night, bam, period came. Like, okay, great. So, but it's just that, and seeing those rhythms in yourself and seeing how things improve over time too when I take better care of myself. It's just, yeah, it's very honestly, it's I feel like it's my superpower, honestly, like having, and my whole life I was embarrassed of my period. I thought it was gross, embarrassed to buy tampons, and, didn't want to talk about it. And now I see it as just, oh my God, like I was ignoring this my whole life, and it's this amazing thing. And I talk about it to my son, like he understands what it is. Like I tell him everything because I'm like, you're going to be a good husband one day. Boyfriend or husband, so you're going to know that this is normal. But yeah,
it's
it's a shame
making
that we don't embrace it more.
and I think that's incredible that you've had only like 4 or 5 years. It's actually crazy. And then it's the reality of a lot of people, right? And of course, we cannot deny the contraception has saved us a lot of unplanned
That's
pregnancies, right? Which is
Yeah, that's the tough
obviously
part. Two
the
things can be true, again.
exactly. And I really hope we find a more less invasive way of
Mhm,
help women and men not have unplanned children. I really hope like that. For me, it baffles me that we have not gotten there yet. Just like
mhm,
just from what we know about the pill and the cycle and how important it is for us. Like I think we should be much further along and a less invasive way of doing it. But
mhm.
let's hope all this AI is going to solve it for us.
I'm glad you mentioned that too, because it's tricky to talk about that topic because you have to acknowledge the freedom that's given women over their reproductive health, and there's no questioning that, and that is a standalone fact. It is
Yes.
also a standalone fact that it's disrupted a lot of things in our bodies. And so it's just making decisions with the full breadth of information, making decisions knowing everything, having all the evidence in front of you and making the best choice for you, at the time of your life that you're in, the season of life that you're in. But I think for us, we're really just speaking about birth control from a PCOS perspective right now, right? From improving PCOS. So I just want to clarify that. Like people take birth control for family planning. That is a completely separate topic. That's not what we're talking
Yeah,
about. You
yeah.
do what you got to do.
Yeah, but it's sad, right? Because that like you kind of have to choose, which is actually for me it's
It
quite
is.
devastating. Like you
Yeah.
have to choose between do I want to end up pregnant at 18 or like or actually be connected to my body and who I am and my
Mhm.
cycle. I think that choice it's actually sad that young women and older women have to make in order for them to live, a free like a
Yeah.
free life.
I will say, though, that some of the technology that has come out, the natural cycles now has a wearable that helps track your fertility based on temperature. So, fertility awareness method, a lot of people confuse that with, I forget what the other method is called, but the fertility awareness method is where you're checking your temperatures every day, you're checking cervical position, you're checking cervical mucus. And so that can be really helpful for women who are trying to get pregnant or who are not, trying to not get pregnant, trying to avoid it. And there's also temp drop is amazing for that. So there is some technology out there and people are teaching fertility awareness method. I just wanted to drop this resource for women. The best book I ever read in my whole life was top five, was The Fifth Vital Sign by Dr. Lisa Jack.
I've not read them.
Full book. It's how I learned my body. It's how I learned about the cervical mucus chapter was like, I just totally nerded out on that. And like every time I see my cervical mucus now, I'm like, I'm a badass. It's so cool. Because I always thought it was gross. I was like, what is that? It's disgusting. But when you learn what it does, you're like, oh my God, that is so fascinating. So that's a really incredible book. And she teaches fertility awareness method kind of she has a podcast called Fertility Friday. I think she works with clients, but her book talks about it and just kind of teaches you what it is. But I think it's great because it teaches every woman the intricacies of her menstrual cycle. So I that is just a non-affiliated plug for her. I just am very passionate that every woman should read this book. My daughter is going to read it when she starts menstruating, whether she wants to or not. It's yeah. Anyway, so I wanted to share that resource.
Amazing. I'll definitely drop the actual link in the
Yeah.
newsletter itself. So, just to conclude, because we could be speaking forever, I will say one last thought for women with PCOS, and I'll pass over to you. But I think my one is please do not take Instagram and all or nothing kind of black and white statements as the truth
Hmm.
about anything, but specifically about your health. Please do understand the nuance. And there is a lot of resources like Tara's, Substack and Georgia. And there's a lot, like we share a lot between ourselves here on Substack and every have made it their mission to go into this nuance and understand it because it is out there. And little by little, we will be getting much better at this. It's just taking that extra step to understand your body and who you truly are in your PCOS and in your cycle. And
Hmm.
then give yourself that love to understand it rather than taking advice from someone on the internet that says you must lose this amount of weight too, or
Yes.
you must cut gluten out, or you must cut dairy out to be able to be healthy. So that's my closing thought. What's your closing thought, Sarah?
Mine is we can get really in the weeds and very myopic about certain topics and foods and strategies and things from the internet. And I just want to remind everybody that really where the change happens is in the absolute basics. That is where most of the change is going to lie. And that is eating more whole foods, eating less junk food and processed food, knowing how to fuel your body so you feel full and satiated, getting proper rest. It's just such a huge thing for PCOS. I know it's like, it sounds like a soundbite, but the evidence about sleep, connection to insulin resistance, and metabolic health is profound. The Why We Sleep book is really great to understand that, by Matthew Walker. Stress is huge. So, having a daily practice that you can show up for and commit to, having some type of movement that gets you going, that you enjoy, that you'll show up for, I promise you that like the majority of the change you're going to see is from those core things. And so I see people starting with like these little tiny microscopic changes when like they still haven't worked on the pillars of health, like the macro things that really support our hormone health, our metabolic health, cardiovascular health, all the things that we're concerned about with PCOS. So that's why I tell my clients is like when you find yourself getting real in the weeds with something real specific, you got to zoom out and be like, wait a second, like, is this really important right now? Or should I be focusing more on just having colorful vegetables once a day or whatever it is that goal is for that particular person? So don't major in the minors. That's the way to sum all that up.
I absolutely love that, and I completely agree. Thank you, Tara.
Yes, pleasure. Thanks.
Bye.
Bye.